29 years old and have congenital bilateral ptosis. What procedure is the best for me and how much would it cost me? I'm a Filipino and have relatives in the US, so I am willing to travel there if I would be assured that my condition will be corrected. I worry that when I get older, my eyes would be worse, as well as my eyesight. Looking forward to any response.
Thank you for your question. You submitted your question with several photos, and you describe in your question that you are 29 years old and that you have congenital ptosis, and that you are willing to travel to have your ptosis corrected, and you want to be assured of the outcome so that you would it'd be worthwhile traveling. Well, I can certainly give you some guidance about this type of issue, which is a very common issue in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Eyelid ptosis is one of the most common things that I take care of in my practice, and it's been, of course, a wide range of different ptosis conditions, and I've been recognized in the media periodically for this type of surgery, and people have traveled from around the world for me to do this. Now, that being said, I think it's very important that you first get a proper evaluation by a doctor that is more local to you. The reason is as follows. Ptosis surgery has a certain amount of standardized approaches based on some key elements of an examination. When you do a ptosis evaluation, you look at the eyelid height, and you look at a particular function called the levator muscle function, when basically the patient is asked to look down and look up. And when you're doing that, you're getting a sense of what kind of strength that muscle has. The reason someone has congenital ptosis has to do with the development of this particular muscle called the levator muscle. It's like the word elevator without the E. And it's the muscle responsible for lifting the eyes. Now, just by looking at your photos without the benefit of physical examination or any other eye position movement, I would suspect that if you have a relatively significant ptosis with minimal levator function, then there is a good chance you'll need a procedure called a frontalis sling. And a frontalis sling is a procedure where because the muscle that lifts your eyelid is not that functional, then it requires connecting the forehead muscle, which is called the frontalis muscle, that you often use to raise your eyebrows to try to get the eyelids to open. It's a very common thing for people with ptosis. In fact, a lot of patients who have ptosis, as they get older, their forehead lines get deeper because of this activity. Nonetheless, this is one possible option, and when it comes to ptosis surgery, it's also important to get a proper eye evaluation. It means checking your vision, checking the function of the eye's ability to protect itself with eye closure. Sometimes when you're being evaluated for ptosis, the ophthalmologist may want you to also be evaluated by a neuro-ophthalmologist, just to make sure that other systemic issues that could affect eye function are managed before doing the ptosis operation. Now, ptosis surgery, of course, then when you're making your decision, you want to look at the surgeon's experience and what their recommended approach is. And between oculoplastic surgeons, there are always going to be different opinions about what an individual oculoplastic surgeon is going to be comfortable with or prefers. And it is sometimes challenging to make a really ideal choice, but also understand that when a person is born with ptosis, particularly when they have moderate to severe ptosis with minimal to moderate levator muscle function, the accuracy of achieving an optimal result has to be within a certain range. And a lot of times with patients who are a little bit older, like yourself, we actually do ptosis surgery with the patient awake. And that way we can actually adjust the eyelid height and actually sit the patient up during surgery to make sure that the height and the symmetry looks good during surgery. So I think it's a good idea first for you to find some qualified, experienced oculoplastic surgeons locally, get some opinions. If you want to travel and get additional opinions, of course, that's a choice, and make a decision with whoever and wherever you feel comfortable. So I hope that was helpful. I wish you the best of luck. Thank you for your question.